Neural impulses travel in the spinal cord via tracts. The impulses could be sensory, coming from peripheral nerve via sensory receptors, which want to ascend to brain. Or they could be motor orders from brain traveling to muscles, via the descending tracts on the spinal cord.
We see in the diagram, the ascending tracts are illustrated in blue on one side, while the descending tracts are illustrated in red on the other side. But important to remember that the ascending and descending tracts are present in both sides of the spinal cord.
This is the anterior side and this is posterior. And the diagram is arranged as if we are looking from above to a section of the spinal cord.
The reason we need to study these tracts is that certain disorders affect some tracts, but not the others. We will see examples of a disease that only affect the dorsal tracts, so position and vibratory sensations are affected but not the others. And other diseases that affect other tracts. Thus, understanding which tract is present where and what is its function is clinically important.
The ascending tracts of the pathways are sensory. We see that the ventral spinothalamic tracts carries sensory fibers of pressure and crude touch. The lateral spinothalamic tract carries pain and temperature. Proprioception, sensation of movement and location, is carried by ventral and dorsal spinocerebellar tracts. And finally, we have the dorsal column composed of gracile fasciculus and cuneate fasciculus. It carries sensation of position, vibration, pressure, and fine touch.
On the other side, we see the descending tracts. We have the lateral corticospinal tract carrying fibers from brain to muscles for voluntary movement. Reflexes and postural movements are transmitted via these tracts. And the voluntary axial movements are carried via the ventral corticospinal tract.
Now talking about some clinical examples. Tabes dorsalis is a form of neurospinal. It is associated with damage to the dorsal columns. The patients, thus, develop loss of position and vibration sensation. They develop sensory gait ataxia and paresthesia of extremities. The lateral spinothalamic tracts are not affected. Thus, if we examine pain and temperature sensations in these patients, we find them normal.
Vitamin B12 deficiency can lead to damage to dorsal columns of spinal cord, giving similar picture to tabes dorsalis of loss of position and vibration sensation. But in addition to that, vitamin B12 deficiency also affects the lateral corticospinal tract, which causes upper motor neuron signs and positive Babinski sign.